I'm Dr. Barry Eppley, plastic surgeon of Indianapolis. I wanted to review with you a case using a combination of your own tissue fat and that of synthetic implants. And this is dealing with a specific, although not uncommon, facial condition known as facial lipoatrophy. Facial lipoatrophy is a condition that we all have seen and simply didn't recognize it for what it was. Some people would refer to this as a gaunt look, sometimes associated with aging, sometimes part of a disease process, and a lot of times just part of somebody's congenital makeup of the way that they were designed to look. This creates a very hollowed out or gaunt type of appearance, and it is marked by hollowing beneath the cheekbones, really loss of the buccal fat, so that one has a very prominent cheekbone looking very skeletonized, and then a generalized loss of fat underneath the skin below the cheek area, extending out in towards the face. This creates a very indented or sunken in type look, and some people have it in a very mild fashion, and some people have it in a much more fashion, as one might see here. The hallmark is an inward sunken in look immediately beneath the cheek area, creating that look. It is possible to treat this very successfully, in my experience, with a combination of two plastic surgery techniques. The first would be that of an implant that goes under the cheek area. Now, this is different from a cheek implant. We call this the submalar implant, where it sits underneath the cheek prominence. You certainly don't want to increase the cheek prominence in this case. You want to try to fill out the area beneath it where some of the buccal fat pad has been lost. And this implant can be placed through the mouth, as the standard cheek implant is done, and secured to the underlying bone. As a combination with that, because the implant can only extend so far, then fat injections are done throughout the remainder of the sunkening areas throughout the face where the implant cannot reach. This fat can be harvested from any number of areas, and in this particular patient came from the stomach. I have found this combination of submalar implants and fat injections to work quite well in a very predictable manner. This creates increased facial fullness and actually makes the patient look a little more healthier and gets rid of much of that sunken in type appearance. Again, this creates fullness in both the below the cheek area as well as out into the sides of the face, overall facial volume. I have treated numerous facial lipoatrophy patients with this approach and have been very satisfied with it. I find it more satisfying than fat grafts alone, although there is certainly nothing wrong with that approach. It is just that the implant in that area is certainly always predictable.